Endoscopic ultrasound, or EUS, is a minimally invasive technique which allows doctors to obtain detailed images of the pancreas. The patient is asleep during the procedure. A thin, flexible tube called an endoscope is passed through the mouth into the stomach and the first part of the small intestine, called the duodenum. At the tip of the endoscope is a miniature ultrasound probe. This probe emits sound waves, which pass through the stomach or duodenum, creating an image of the pancreas. EUS has an advantage over other techniques to image the pancreas because it can be used to obtain tissue samples from abnormal areas of the pancreas. This technique is called EUS guided fine needle aspiration, also known as EUS-FNA. EUS-FNA is important to help doctors correctly diagnose the type of pancreatic abnormality so that the patient may receive appropriate treatment. Once an abnormal area of the pancreas has been located, a very thin needle is passed from the tip of the endoscope into the abnormal area under continuous ultrasound monitoring. This fine needle biopsy is painless. Once samples have been obtained, the needle is removed. The tissue sample is examined by a pathologist to determine whether the tissue is cancerous or non-cancerous. Some centers, including Johns Hopkins, can examine the tissue during the EUS procedure to confirm that enough tissue has been obtained for a diagnosis. EUS-FNA takes about 1 hour, and patients can return home an hour or two later.